She's ready. Let's go.
Hello. Hi, it's really great to see so many people that look familiar to me. So thank you very much for inviting us to come and speak on women's health and wellness. So I brought my team with me. They're in that corner there busily setting up because at the end of my talk, we're going to be doing a health check with a difference. So can we start? So we're from Star Lane Medical Centre, and I think a lot of you will recognize this building, which is literally 2 minutes walk away. My name is Caroline Fang. I'm one of the GPs there, and I've been there for over 30 years, so that's why I see so many familiar faces. But I brought along with me Nurse Esther. Do you want to give a wave, Esther? Nurse Seong. Eileen, she's an AMP. And Joseph. So we've got the A team here. So Star Lane Medical Centre, we moved there in the year 2000. And at that time, we had about 9,500 patients. And today, we have 21,000 patients. Not only have we grown, but the area around us has grown, and it's changed within the last 30 years to some parts of it that I don't even recognize now. So we have 13 regular GPs, and that's probably why you don't see me as much, because I do a lot of the managerial and the administrative stuff, but I'm still there 3 days a week. And the other 2 days, I'm looking after my grandson. Thank you. We have 3 nurses and healthcare assistants, 2 ANPs. The 2 ANPs we've got are not the 2 that are here today, so we have a very large team. We have 2 social prescribers, a 1 health and well-being coach, 2 advanced practitioners who are physiotherapists. We have a mental health nurse, and we have 5 clinical pharmacists. So you can see, when I joined 30-odd years ago, there were 6 GPs, for those of you who might be remembering back in those days at the old surgery. And we didn't have any of these supporting staff apart from 2 nurses. So, you know, healthcare has changed tremendously over the last 30 years or so. So, on the website at Newham, this is us. All of you and me, we're very multicultural in Newham. And I was thinking, when I got this email and invite from Pastor Leandro, what it was that I was to be talking about. And he mentioned in his email to be, what were the words that you used? Something like precise, reliable, and practical. And so I'm trying to meet the brief that he's asked me to. And I wondered why I'll be talking about women's health on today, so on this day today. So what is tomorrow? Any special day tomorrow? It's International Women's Day tomorrow, which it's a yearly event. So before we talk about health, I just wanted to celebrate some of the women that have been, that were born and grew up in Newham, basically, that you might know about. And the first one I'm pretty sure that you all recognize is, sorry, I keep forgetting to say next because I'm doing my own next, is Dame Vera Lynn. And she lived to a ripe old age of 103. So that's really interesting. Honor Blackman, she was born in Plaistow. So Dame Vera Lynn was born in East Ham. Honor Blackman was born in Plaistow, and she died at the age of 94. Hannah Dadds was born in Forest Gate, and she was the first female underground driver. And there's actually a plaque in Upton Park Station. She died in 2011 when she was 70. And Daisy Partson was the first female mayor of West Ham. Anybody aware of that? I wasn't. So it's lots of things that I've learned about important women that come from this part of London. Josie Wood is a really interesting lady. She was born in 1912 in Canning Town, so that's very near to us. Obviously, we're in Canning Town. Her father came from Dominica, and her mum was the daughter of a docker, because we know that lots of dockers in this part of London. And she taught people about Black British history, because at that time, obviously, it wasn't It wasn't sort of predominantly discussed as it is nowadays. And she was a dancer. She decided that she had a talent for dancing, so she went into dancing, and she introduced something called the jitterbug to UK. And I thought, oh wow, that's a disease that I've never heard of. I better look that up. But anybody know what the jitterbug is? Yes. So it's a dance that became very popular in the 1930s and 40s. So it wasn't a disease that I thought, it's a dance. So another question, we've got some fruit over there, so if anyone gets questions right, you might get a piece of fruit. Anybody knows what the official motto is for Newham? So I've worked in Newham for over 30 years and I didn't know. And the motto for Newham, with the coat of arms, is progress with the people. Did I hear anybody get it right? Oh. No fruit for you then, not at the moment. Okay, so welcome to Newham. So I'm thinking that everyone in this room, not only are we majority ladies, but we either live, work, or stay in Newham. Is that right? Hands up. We live, work, or stay in Newham? Yeah. So Newham is a great place to work for me. I've been here a long time and I've never moved from being a GP here. And in fact, there's quite a lot of GPs, as you know, who have worked here for many, many years. Some of them only just recently retired, and I know that you'll know some of the names off the tip of your tongue. So Newham's population is about 350,000. We're the third fastest growing borough in London, and the majority of our population are non-white. And it's a young population. So we're the most diverse borough in London. And although I've put 100 languages, people are telling me it's far more than 100 languages we speak. And we know as health professionals that when we see patients, very often the patient is not conversant in English, and we have to use something called a language line to help us to translate. So on the right side of the patient, you can, right side of the PowerPoint, you can see, the languages that we often have to use for translation. And obviously in your church, I think Portuguese is predominantly the second language after English, which is really good that we've got bilingual people. So we're diverse, we're creative, we're rich in culture, and I think we should be proud of that in Newham. And this shows a population, it's like a bit like a scatter graph. So in the black, that's the national. If you look, let me start at the beginning. If you look at the bottom of the central column, we're going up in steps of 5 years. So you start at the bottom, 0 to 5, and at the top, you end up 90 plus. And if you see the black lines, that's nationally what the makeup is of the population. But in the pink is Newham, and you can see that we stick out in the age group, particularly between 20 and 39. And many of you will know that particularly during the Olympics, many younger people came into Newham because they were working population that were helping with the building with the Olympics, and they stayed on. So there's a lot of young working population. So this is our architecture that we see in Newham, which I think is really beautiful. There's some buildings that I think we all hopefully appreciate. I love the Newham Town Hall. I've been there for some meetings. It was built in 1901. We've got the Orbit that was built obviously for the Olympic period, which was 2012. And it's got the longest and tallest tunnel ride. So I just wanted to ask, has anybody done that ride? No? Have you done that ride? How was it? Not scary? It was good. I've done that ride. We had a doctor's meeting, I can't remember, maybe 10 years ago, and I've never heard doctors scream so loud. We had GPs making fools of themselves going down this large, long, tall tunnel slide. So, sorry, next. And then we've got the velodrome, all these beautiful buildings that we have with these unusual shapes. And we've got one of the best schools now in London that is famous for getting our population into really high caliber schools. So we've got lots of wonderful things happening in Newham. But when I look at the heat map for health in Newham, in meetings that I go to, I see that. Does anybody want to hazard a guess why that colour's been placed on Newham? So that's the whole of Newham, and then Newham is in red. Anybody want to hazard a guess why we're red? We'll talk about that as with the other slides. But I think red normally means stop, careful. Something is not quite as good as green. So it's something about our health in Newham that we need to look at to make it greener than red. Does that make sense? So, before we start, because we're going to do a little quiz at the end as well, I just want a show of hands to tell me how many of you are confident about what numbers your blood pressure should be below to be in a normal range. Is anyone confident about that? Oh, yes. Good. Got 3 or 4 hands. What's the number? Near? You've not got fruit yet? Near? We'll talk about that in a minute. So we've got 120, 80, 130-ish near. Now this is an interesting, and we'll talk about that in a minute, but not quite. So we had 4 hands. How confident are you about checking your blood pressure at home? Oh, that's good. I hope that will change by the end. Can you name 4 screening tests available for women in Newham? Any? Can you do 4? You'll be able to do that? We've got 1 person. I'll test you in a minute. We'll show that, we'll get to that. But just a show of hands, okay, so maybe 2 or 3, because we're hoping that will improve by the end. Is Pastor Leandro here? No? I just want to check that we have got 2 hours, because I do go on a bit. Yes, we've got 2 hours, okay. I won't be talking for 2 hours, be relieved. We're doing most of it's going to be health check. So what are we talking about today? We're going to be talking about women and wellness. Then we're going to be talking about the screening programs, which some of you will know about. We're going to talk about CVD prevention, and I'll explain to you what CVD is. And we're going to talk about that in our Newham locality. And then we're going to talk about what's important, what we can do to keep ourselves healthy. And then we're going to learn together and do a few health checks amongst you for those of you who would like that. So we'll start with women and wellness. And the question is, why is wellness so important? I think you might not be surprised, but some people are very surprised, that while women in the UK on average live 5 years longer than men, women spend a significant greater proportion of their lives in ill health and disability when compared to men, which is very worrying, isn't it? So, when you look at that next slide, when you look at that with the life expectancy in Newham, around 83, 85 years for women, the portion that is in dark orange is a portion of life spent in not good health. And that's not what we would want, isn't it? So we would want to live as full of life as possible in as good a health as possible. So the WHO, the World Health Organization, they define health. It's not just about an absence of disease, but it's a state of physical, mental, and social well-being. So you might not have high blood pressure, you might not have a lung disease, but you might be suffering with anxiety or mental, illness or other conditions that you can't see and you can't measure. And that is not a good state of health. So the focus really for the WHO is about preventing disease, and that's why we're here today, and keeping ourselves as healthy as we can. And the foundation of the message actually is about things that we can do to help ourselves. So it's about the food we eat, how active we are, and how we avoid habits that can shorten life and worsen our health. So now we're coming to the screening program. So I heard, did somebody say over there what screening programs we have? Can I hear? Sorry? Brilliant. Can we have a fruit for the breast screening lady, please? Have you packed them out? We'll bring it over to you in a minute. Yeah? There we go. So breast is 1. We've got 4. So by the end of this, hello? Bowel cancer. Excellent. We've got a lady here. And fruit is very good for preventing bowel cancer. Any more? Smear test. Oh, you're really good. That's 3 out of 4. You've got 2 there. Smear test, can you put your hand up? Eileen, there's some dry fruit as well, I think, that you can scatter in there, for those that don't want fresh. One more. Yeah, smear test. So one more, maybe you'll not be so familiar with because it's a more recent one, but we'll talk about that in a second, okay? So why are screening programs important? They're important because that's how we detect disease earlier. Sometimes you don't have symptoms, but we can detect disease earlier. And we know that 1 in 4 deaths in the country and in Newham are due to cancer. So all of these screening programs is to detect cancer early. If you look at this, sorry, the next one. If you look at this, I think we feel quite embarrassed in the UK and England that the survival rate, the 5-year survival rate, when you look at that, we're way down. We're way down here. And the reason isn't because the treatment that we have for cancer isn't very good, because our local hospital, Barts, is a cancer institute. They do lots of research, Queen Mary's, for those that might be connected with them or have worked with them before. They're world leading in cancer, but why are we not performing well in terms of survival? Next, please. The reason why is here. If you look on the internet, for those that can, there is a website called Fingertips. And on Fingertips, it shows public health outcomes. And as with anything, when you look at food, you've got red, orange, and green. When you see red, that doesn't mean very good. We can do better. So when we look at this, and we look at how we perform in Newham in terms of screening, we're red in everything. So in the mammogram, the breast cancer screening, we're below. On the right of red is how the areas around Newham in London, and on the very right is the national figures. And we don't do very well. And that is really important, because if cancer is not picked up early, the outcome is very, very much worse. So this just shows on the right-hand side, obviously we're all women here. At the top, the most common cancer is the breast cancer, followed by lung cancer, and then bowel cancer, which we call colorectal, and then beyond that is endometrial and uterus. You will notice that at the moment, the incidence of cervical cancer is not featured there, and that's because the program for screening for smears has been around since 1980s, about 37, 40 years ago, and that has been very successful. I think most women do try to come, but we still are red in that area. So the 4 national screening programs, you got 3 of them right, so you've done well. So you've got cervical screening, which starts at the age of 25 to 64. During COVID, Starlane was used as a pilot for this new self-test kits, because a lot of women do find it uncomfortable to have a smear, and some women don't come because they're frightened of having things put inside them. So we had self-test kits that we gave out to patients who were delayed in having their screening, and actually the pilot was very successful. It's been used in other countries, in Australia and some European countries, but it still hasn't come to UK as the norm yet. But in the future, we're hoping that some women will be able to just take a kit home, do a self-test like you do a swab, and what it tests for is HPV, and if that is positive, then you still need to see a nurse to have a full smear test. But that still is not here, but that's something that, that's coming in the future. With mammograms, and the other thing with the cervical screening, you might be used to having a 3-yearly recall, but the nurses, I think this year we're starting, if it's normal, to go up to 5 years, isn't it? Yeah, it's a 5-year recall for the under 64, the under 50s. The over 50s already is a 5-year until the age of 64. With a mammogram, you get a recall from the age of 50, and it starts at the age of 50 and it ends at 70. But at any point, if you felt that you've missed it, there is a number generally you can get from your surgery that you can ring. With bowel screening, starts at 50. They've reduced the age to 50. It used to be 55 or 60. It's gradually gone down because of the increase in bowel cancer, and it's every 2 years. And lung screening is a new one that started during, we were again a pilot site, and it started, basically what they do is to extract data from GP surgeries and patients who have a history of being an ex-smoker or a current smoker, they will offer that, a lung screening. So, for those of us who've been to mammogram screening, the Guttman Center, anybody been to the Guttman Center for their screen? Yeah. And that's where you go in Stratford. It's a very posh building that was built during the Olympic time again. And lung screening, as I said, is by invitation. So you have to go, it's in Tower Hamlets if you get called up, and you have to go through this tunnel thing. Sorry. Yeah. Next. I think we're ahead. Okay, next. Again. Again. And again. That's it. And then, a warning. Next slide. So getting to the bottom of it, a warning alert for the queasy. Have you had your lunch? So as you know, I sit in my room and I see patients every 10 minutes to talk about one problem. And there have been some interesting conversations during those 10 minutes about a pack that they receive through the post, and what do they do with it, and how do they collect their poo, and where do you stick this thing in, etc. So, from the age of 50, every 2 years, we will get a pack through the post on the left that contains a little tube like that, and when you open it, it's got a little probe on the right-hand side. Next. And you have to be creative about how you collect your poo. So I just say any way you can think of to collect your poo. It's okay. But you don't need to get the poo inside. You don't need to fill it, because I have patients that, how do I fill that tube? You don't need to fill the tube. You poke the green thing into the poo, put it back into the pot that you've been given, and then put it in the envelope that you've been sent, and then send it through the post. That one's really, really important because we have a really low uptake of bowel screening, and that's one of the fastest growing cancers in women. And I've seen quite a lot in younger age women over the last few years, which is really sad because it's picked up really late. Next, please. So, reducing the risk of cancer. What can we do to reduce the risk of cancer? There's lots of evidence. We didn't think of that before, but there's lots of evidence that eating healthily and looking after ourselves that can actually reduce the risk of cancer. So looking at how we eat can help breast cancer. There is evidence there. Next slide. And also lifestyle. So staying fit, eating healthily, and all the things that we'll be talking about in a while, avoiding too much alcohol, and getting vaccinated at the right time. Next, please. Here we are. That's us. Does that look like us? So the next area that I'm going to talk about is CVD prevention, and this is in our locality. Next slide, please. So I'm going to be talking about population health and wellness. So we talked about screening, which is a person-centered thing, but one of the things that we need to think about where we live is about population health. And population health, people are very upskilled and trained in the London Borough of Newham. There are doctors and scientists that are very upskilled in public health. And people, I don't know if anyone here have got a public health degree, but it's an increasing number of people are taking degrees in public health. And what public health looks at is the population health as a whole. So it's not just Darlene, it's not just the people in this area, in this room, but it's in the area, Newham. What is particular for Newham, and how can we improve the health of our population? And a lot of it is about prevention. So anybody heard of the NHS 10-year plan? Did you hear it in the news? Yeah. Good. So well, you know that there are 3 areas in the 10-year plan, but the area that we're going to talk about really is prevention, because that's where we can try and prevent disease happening. So it's prevention rather than waiting until illness gets to us and then having to worry about what medication you go on, etc., to reverse that. And part of the 10-year NHS plan is is neighborhood working. So I was really happy that we're here today and to work together towards improving the health of Newham. So this is a map of Newham, and you can see in the green, we're green here, we're Canning Town North, Canning Town South, and Custom House, which is our ward, isn't it? So, yeah. So, yep. Next, have we got that? So next slide. So at a higher level, at the system level, where we're talking about health, we've had meetings with public health, and we've kind of divided Newham into 4 areas, and we fall into the southwest. So we're called Southwest Locality, which includes Custom House and Canning Town, and also Plaistow. We've had a couple of meetings trying to engage some of the community, and the last meeting was in Custom House, one of the centres there. But if there's anyone that's very interested in being part of that, that's fine. You can let me know, and you can be invited to the next meeting. So when we looked at the data for the Southwest Locality, we had to decide on what are we going to look at, and what can we make a difference, and where do we need to think about making a difference. And again, we looked at fingertip data, and we saw, quite sadly, that in Newham and in Southwest Newham, that we are not living as long as other parts of the London. So we die earlier, and a lot of it is related to cardiovascular disease. So we're not on cancer now, we're on cardiovascular. So we're not living as long as we could, because we are dying from something called cardiovascular disease. And cardiovascular disease, for the most part, is preventable. Next slide, please. And the next. So if you look at this, it shows the under 75 mortality rate. That's people who die prematurely from cardiovascular, and you can see that we are very high in Newham. There's only a couple of boroughs that are similar, and that's Tower Hamlets, Barking and Dagenham, and higher than that is Hackney, where I grew up. So Hackney is also having to tackle cardiovascular disease. So you might ask me what cardiovascular disease is. Just a medical, a posh word for a group of conditions that lead, if we don't look after them, to heart attacks or strokes or clogged up blood vessels in the legs. You can't walk, you get pain in your legs. So that's what CVD is. So if you ever get a text from me saying, come and have your CVD check, that's what it's about, is checking whether you have any risk factors for that. So what contributes to cardiovascular? Well, there's some things that we can't change on the left-hand side. It's our age, the genetics that we carry, the ethnicity. We definitely know that some ethnic groups are more at risk, and men are more at risk than women. And I'll tell you something interesting later about women and what kind of protection we get from periods that we don't enjoy, but we do get protection from that. And then we talk about the health conditions that actually lead to cardiovascular, which is high blood pressure, diabetes, cholesterol, and our weight. And then we talk about lifestyle factors like stress, not doing enough walking, eating the kind of foods that are not best to eat, and smoking and alcohol. So on the top left there, next slide, sorry, top left there, you can see the high blood pressure affects them more than one of us, 1 in 4 of us in England. And on the bottom right, at least half, this is really important, at least half of all the heart attacks and strokes are associated with high blood pressure. It's a major risk factor, not only for that, for kidney disease as well. Next slide. So high blood pressure, it's a silent killer, because many of us might have it and not know unless we get it checked. And some people don't know until they end up in hospital, either with a heart event or a stroke. Next slide, please. So it's really important that we take control, and we do know that it's really important in this part of London that Afro-Caribbean people of Afro-Caribbean descent develop high blood pressure that can lead to strokes and heart attacks. Next slide, please. So I'm not sure if you're aware that if you do not have a blood pressure machine at home and you're not sure whether you have a blood pressure problem, you can simply go to your nearest pharmacist. And if you're over 40, you can get your blood pressure checked, and they will let the GP know if you have any issues there, or advise you whether you need to have a 24-hour blood pressure monitoring done. So next one. So know your numbers on your health, and I hope by the end of this we'll know our numbers. So we had 120 over 80, we had 130 over 80, which is near to it. Interestingly, at the moment, 140 over 90 is a number that we use in the UK as a cutoff point for high blood pressure. But, let me just get the right slide, but if you go down a few slides, next one, right. But, as you know, similar to diabetes, similar to anything in terms of health, it doesn't happen overnight. So your 120/80, if you were living in America, would be correct. Between 120/80 and 140/90, you have this pre-blood pressure thing that you can get with pre-diabetes. But in the UK at the moment, we still use 140/90 as a cutoff point. So I want you to remember 140/90. I'm going to test you later. So can we go back up a couple of slides? Up again? Yeah. So just another reminder that you can get your blood pressure checked in the pharmacy if you're over 40 and you don't know whether you've got a blood pressure problem or not. And we have in Star Lane, there's a place in the left-hand corner as you walk in where you can just self-check your blood pressure. Next slide, please. And the next. And up one. So when you take your blood pressure, back one, sorry. When you take your blood pressure, some people give numbers and they're not quite sure which numbers we should be looking at. On your blood pressure machine, the top number should be that one, 140 over 90, and the very bottom number is your heart rate. Okay? Next slide, please. And the next. So, I'm going to tell you something interesting about we women, and cardiovascular disease. So, on average, we have periods for 35 years of our life. That's on average. And then we come to the menopause. And now, during those 38 years, it's a pain, isn't it? Every month you have to worry, make sure you've got your towels, make sure you don't leak, make sure you're wearing the right clothes just in case. But during those 35 years, while you're actively having periods, we have some protection against cardiovascular disease. And actually, the incidence of cardiovascular disease in women is lower than it is in men. When we get to the menopause and we develop all of these horrible symptoms, brain fog, difficulty concentrating, anxiety, impression, joint pain, etc. Next slide. What happens is, we get to the menopause, we stop our periods, but the risk factor for cardiovascular actually increases. So, and the next slide, please. So, whatever is protecting us while we're having our periods is removed when we reach to the menopause. And the incidence of heart disease actually goes slightly higher than men for a short while and then just catches up with them. And also, the incidence of diabetes, the risk of diabetes increases after menopause. So it's just an interesting study that was done that really, makes you think about cardiovascular disease in women and how that differs. Next slide, please. So, what can we do to keep ourselves healthy? Well, top tips for the healthier blood pressure would be to cut down on salt, eat plenty of fruit and vegetables. We're going to be talking about that at the back later on when we do the health check. Watching our weight, making sure we exercise regularly. I'm really bad. I'm sitting all day in an office, so it's not great really. But we need to make that time to make sure we walk, and it's recommended that we at least do 30 minutes 5 times a week, like 150 minutes per week, and that we don't go over the top with alcohol. And then nutrition, eating a balanced, healthy diet, choosing fruit and vegetables, try to limit processed foods and things that are being pre-prepared, and cut back on salt and saturated fats. And very often when you go to the supermarket now, wherever you buy, they have a color coding, don't they, about what's good, what's red, not so good, as green is better, etc. So next slide, please. And then we've got Eat Well Guide, which is an NHS thing that you can find on the website, but we've also got it in one of the books that we've got there later on that you can have a look at. Next slide, please. Physical activity. We mentioned that we need at least 150 minutes per week to strengthen our muscles. We found that during COVID, what happened was that the amount of patients who were falling at home practically tripled. Is that right, Joseph and Eileen? Falls almost tripled during COVID. We weren't able to go out and exercise. Our muscles were getting weak. And so exercise is not just about cardiovascular disease and hypertension, but preventing us from falls and making us stronger. So again, when you look at fingertips, you can see that we could do better at eating fruit and vegetables, doing the right amount of exercise, and keeping our weight at a healthier level. So when we look at how active we are, this is Public Health England, you'll see that only 1 in 4 of us women actually do the adequate amount of exercise. And bottom right, it's really embarrassing that 30% of people over 16 sit and do nothing physical for an average of 6 hours or more on the weekdays, and at weekends it's 40% of people. We all do that, sit down and just watch TV or talk or whatever, and it doesn't do very much for our health. So from 18 to 65, it's important at all age groups. Physical exercise is really important to maintain independence, to prevent falls, and to reduce the risk of high blood pressure and cardiovascular. And physical activity in patients have also shown to lower health risks. So you can see there that it actually does reduce the risk of depression. A lot of people find that when they feel anxious or really down, that they go out for a walk or go out for a jog, and that it actually helps them. And interestingly, recently, it also shows that being physically active does help to prevent dementia, memory problems as well. So it's really important that we think about that, and we all could improve on that. So keeping active, what's there available in Newham? Anybody? There's lots of stuff on the website that we probably could use more. There's a little app that I've downloaded called Better Points that it encourages you to do things, and I think you can save your points and then get some discount or something, or you can get like that. But they've got some walks and they've got active community programs. The nearest library for us is obviously Canning Town, but Custom House also has lots of things, and Plaistow. There's some free park exercise sessions that you can join. And the library, there's some seated exercises as well. So chair-based exercises is just as good rather than not doing exercise. If we're not able to get up and walk, there are lots of really good chair-based exercise that have been accredited and won awards. So that's available in the local library. And there's also free cooking and activity programs available. We have lots available in Newham, and I'm just hoping that more of us will be able to take the opportunity to use those things that are available. So, you know, we know that it's not just about living longer, and it's really important. It's about living happily and more healthily for longer. It's not just about the number of years that we live. So, I hope I haven't bored you yet. Oh, wow, that's nearly 40 minutes. So we're now on to that. That's gone quickly. It might not have gone too quick for you guys. So we're now going to talk about the health checks, because I think it's time that we learn things together, that we don't just go to the doctors or somebody else to get a health check, that you have an understanding and that you feel empowered to do things without having to wait until the next time you see one of us at Star Lane. So, know your numbers on your health. What is the number that we need to keep our blood pressure down in England to be normal? Have you got enough fruit, Eileen? For 140/90. Okay, so we're gonna do a health check with a difference, because we're not gonna just check your blood pressure. We're gonna teach you how to be confident about checking your blood pressure at home. And if you pass the test, who last had a certificate for something that they've done, that they've passed? I can't remember when I last had one. But if you passed your test, we're going to give you a signed certificate from Star Lane to say that you've passed your test, to say you're competent to do a blood pressure at home. So when the nurses, will see you in a minute, we'll talk about how you do it and when's the best time to do it. You do not check your blood pressure after you've had an argument with the kids. Right, and the other thing that we're going to do, we're going to check your height. We've brought our height measure across, height and your weight, and we're going to calculate a BMI. We know that as we get heavier, the risks of all of these things increase. Now, the BMI for UK Caucasian people, the cutoff is around 25. For me, it's 24, so I'm verging on overweight at the moment. So we need to be careful. It's not just about the weight. You have to think about the risk, minimizing your risk of having certain diseases. So trying to keep your weight at the most optimum, okay? And then the other thing, the next thing, slide, we're going to use some of that data to calculate something called a QRIS score, QRIS-3 score, which kind of estimates what your next 10-year risk of having either a stroke or heart attack. And if it's over 10% or 20%, you might want to just discuss that. If you're not already on medication for that, then you might need to think about the things that you can do, the lifestyle changes to reduce that, or if you feel that you want to discuss that next time with your surgery. So what we want to do is to change the map of Newham from that, next slide please, to something looking more like that. And then we can all be proud that we're thinking a little bit more about our health, because it has an impact, and we can teach the younger generation about things that are important. And hopefully when we get older, we prevent having falls, and also we live more independently for longer. So 3 questions. Are you confident about numbers that your blood pressure should be below for normal range? Hands up. Yep. Are you confident? We might not be able to say this one until you've done that, but we hope that you're going to be more confident about checking your blood pressure at home at the end of this. And can you name the 4 screening tests? So you already had 3. So which was the one that was missing? How many people can name the 4 screening tests they think, if they sat and thought long enough, that we have available for women? Yes? More. So if you think above, so you've got breast and lung, and below is bowel. Yes, good. Thank you so much for listening. And the next part of it is that we will be setting up in the corner to do a little bit of a health check. And for those of you, hopefully, that pass, you'll get a certificate.